joining us for this very important event. I'm Brian Peters, the Executive Vice President of Operations with the Michigan Health and Hospital Association, and I'd like to begin by thanking Sparrow Hospital and Health System not only for serving as our gracious hosts this morning, but also for being such critical partners in this effort going forward. I would like to introduce our guest presenters this morning. We have three experts who are going to talk about this very important program. You'll hear from Dr. Stephen Guertin, who is the Medical Director of Sparrow Children's Center and Pediatric Critical Care Physician here at Sparrow Health System. You'll also hear from Kim Sibilsky, the Executive Director of the Michigan Primary Care Association, and from Martin Alwardt, Special Education Director of the Lansing School District. Now, many of you are aware that we have been engaged for the last year in a discussion at the federal level around health care coverage. And in many cases, folks need to wait until January of 2014 for the extension of health care coverage for their family. But we're here today to talk about two programs that have been in existence here in the state of Michigan for some time. Families don't need to wait. We are encouraging families to act now to ensure that their kids are enrolled in healthcare insurance coverage. We all understand the critical reasons why that's true. I'm also today going to walk us briefly through the launch of the new back to school phase of the Enroll Michigan campaign and screen one of the television public service announcements which you will see appearing on cable television yet this week. I'd like to begin by saying that Michigan hospitals and health centers have long been committed to a mission that includes caring for all who walk through their doors and expanding health care coverage and access. For that reason, the healthcare community is proud to partner with schools this fall on the Enroll Michigan campaign to connect our state's kids to health care coverage. According to the latest data, there are approximately 127,000 uninsured children throughout the state of Michigan. It's estimated that at least 83,000 of them, or 65%, are eligible right now, today, for MiChild or Healthy Kids, the state's free and low-cost health plans for children. To illustrate that point a little closer to home, there are as many as 4,600 uninsured children here in Ingham County alone. In response to these challenges experienced by the uninsured throughout our state, the Enroll Michigan campaign was launched in March as a joint effort between the Michigan Primary Care Association, the Michigan Health and Hospital Association, and the Middle Cities Education Association. Since that time, coalition partners have worked to increase public awareness of available health care coverage for kids, trained healthcare workers to become qualified enrollment experts, and provided incentives for friends and family members to refer uninsured children to coverage through enrollmichigan.com. While the Medicaid enrollment numbers in our state have fluctuated greatly this summer, we're very pleased to report that during this time, the MiChild program has seen an overall enrollment boost of more than 2,300 kids. Today, we're proud to announce the next phase of the Enroll Michigan effort, which will focus on connecting kids to coverage during this back-to-school season. As a matter of fact, as we gather today here in Lansing, there are simultaneous news conferences taking place in other cities to make this very special announcement. Metro Detroit, Flint, and Grand Rapids are also hosting their own events to elevate the visibility of this campaign so that word can spread far and wide about the availability of affordable children's health insurance this fall through enrollmichigan.com. I would now like to welcome Dr. Stephen Guertin to give us a physician's perspective on coverage. Dr. Guertin.
Good morning. My name is Steve Guertin, and I'm Director of the Pediatric Intensive Care Unit here at Sparrow Hospital. I'm also Director of the Children's Center here. Actually, we see the consequences of the lack of adequate enrollment in these two programs every day. Children that come to us from either the emergency room or the Pediatric Intensive Care Unit at the extreme end of whatever their disease continuum is. In other words, they come to us when a disease has not been managed, has not been diagnosed, and has reached life-threatening consequences. It doesn't have to be that way. Michigan, the MiChild program and the Healthy Kids program, both of them are ways to prevent this. ways to actually attack those diseases where they need to be attacked, which is in primary care offices. Not only do we need to enroll these children in these offices, we need them to have the benefits of what takes place in primary care, which is early disease recognition, strict and early disease management, and the avoidance of ever having to come to the emergency room or the intensive care unit. There's a second aspect of this that I truly find to be remarkable, and that is that not only does this provide insurance that these kids can have primary care, it addresses new disease issues. We're in a war right now, and the war is not so much with many of the old diseases. Many of those old diseases are nearly defeated or certainly controlled. The new diseases are diseases like diabetes, metabolic syndrome, obesity, mental health issues, failure to have access to dental care. Those diseases and that war doesn't take place in the ICU or even in the hospital. That war is fought out in primary care offices. And what MiChild does and what Healthy Kids does is it gives these kids access to those offices, access to the kind of preventive care and the kind of counseling and the kind of disease management that is necessary for this new war and to fight these new diseases. There's a third aspect of this that I think everybody in this room appreciates, and that's the simple aspect of dignity. People can come to the ICU with their hands out, or they can come to their primary care office in the hospital with a health insurance plan in their hands. And there is a tremendous difference between those two things. They'll get care either way. But care with dignity occurs through MiChild and through Healthy Kids. The only way to do that is to get them enrolled. And I'm actually pretty good in the ICU, and I'm pretty good in the ER. I'm not very good at enrolling people in anything. Kim Sibilsky is, and so I'd like to introduce her.
I'm Kim Sibilsky. I'm the Executive Director of the Michigan Primary Care Association. We're the statewide association of community health centers, and we are so excited to be involved in this partnership. I'd like to throw out a few factoids for you right now. This is looking at uninsured kids in a way I never have before. There are 127,000 uninsured children in Michigan, as Brian said. If you put them hand in hand and stretch them out, they would stretch nearly 97 miles across the state of Michigan. Hadn't thought about it that way. You could fill 2,311 school buses with the uninsured children in this state. And if you were going to form Little League teams with these kids, you would be able to form 14,126 Little League teams with the uninsured children in Michigan. To put it another way, 1 in 20 children in Michigan has no health insurance, and nationally, Michigan is ranked 30th for the well-being of children. Locally in Ingham, Eaton, Clinton, and Jackson counties, there are over 10,000 uninsured children. However, at least 83,000 of Michigan's uninsured children are eligible for low-cost or free health insurance coverage and just need to be signed up. These are serious statistics, but they also reveal an amazing opportunity for all of us. The majority of our uninsured children are eligible for either MiChild or Healthy Kids and just need to be enrolled. The next question is, why? Why aren't these kids enrolled? Well, they're very simple answers to that question. Some families don't think they're eligible. Some are worried the enrollment process is going to be ponderous and complex and they don't have transportation to get to an assistance location. And then again, others may not be aware of these programs at all. The Michigan Primary Care Association and our member community health centers had the opportunity to begin addressing these issues in 2009 through a grant from Centers for Medicare and Medicaid Services. And we have learned a lot in those 2 years. We've learned what to do, and we have learned what not to do. So we're going to work in this coalition, in collaboration, to help to reach out with these programs in the right way that really involves the families and the children in their own enrollment process. So we're looking at a simplified enrollment process. Sounds good. There's no paperwork to fill out. Those who'd like to enroll a child will be asked a series of questions about their family and income. Our staff will fill out the entire application over the course of the conversation. It takes about 30 minutes or less, and we offer assistance in person or over the phone. We don't just enroll, we try to educate and support the families concerning their coverage so that they are encouraged to use preventive services to keep their children healthy. There's very little documentation required to submit the application, at most a photo ID for children over 16 and a birth certificate for those born outside of Michigan. Interpreters are also available over the phone to help us assist families who speak a language other than English, and that service is available 24 hours a day, 7 days a week. We follow up during a child's first year of coverage to answer questions and make sure that they're using the coverage effectively and appropriately for them. So you need to call 211 to get connected to our staff, or visit our website, enrollmichigan.com, to contact us today. In 2009, the rate of uninsured children in Michigan went down slightly, from 5.3% to 5.1%. And we're fortunate to have a very strong track record of covering kids. However, there are more children to reach. The Enroll Michigan campaign renews and strengthens the important work of building awareness, reaching out, and enrolling children. It leverages what we've learned about enrolling kids in the last 2 years and creates a wonderful partnership throughout the community to reach more and more. So my opportunity now is to introduce a collaboration partner, the Director of Special Education, Overseer of Enroll Michigan for Lansing Public School System, Marty Alwardt.
Thank you for everybody coming today. This is very important to the Lansing School District. Afterwards, 2 other members of our district, our superintendent, Dr. Wallace, and our director of bilingual programs, Sergio Keck, will be here to answer questions as well. But I'd like to tell you a story, and this is a very typical story that's happened in our schools. Last spring, I was involved in what's called the child study process for a 3rd grade girl. And the reason she came to the child study process, she was still reading at the kindergarten level. So we collected data, we looked at all of her assessments, we looked at report cards, and then I looked at attendance. And the child was missing 60 to 90 school days a year. Critical learning time, missing 60 to 90 school days a year. So we went to the home, and we asked the mother, what can we do to get her to school? Do we need separate transportation? Do we need to do something to make sure we get your daughter to school? She says, no, I can't get my daughter to school. She's too sick to come to school. Well, can we get her to the doctor? No. She says, I lost my job 2 years ago, and we lost our health insurance, and we're really afraid with all the health insurance bills, if we take her, we'll have more bills. So we're doing things at home to try to help her get better. Basically, when the child finally did get medical attention, the child had diabetes and numerous other ailments that really prevented her from doing well in school. Had this child been enrolled in Enroll Michigan, she'd probably be at grade level because she has normal intelligence. Beautiful little child that has been a victim of probably a long life of poor jobs and poor environment because of the fact she could not be in school because she didn't have the means to get treated for her illnesses. We know that our kids can do much better in our schools if they come to our schools healthy. Dr. Guertin really expressed that very well. We know that a child who is in school is far more likely to grow up to be productive and a healthy adult. A child with health insurance and access to essential health care services is more likely to be a healthier adult, fewer medical problems, and more active in our community. Many times you look at test scores and you look at other things that they portray about schools, and what they're not portraying is the children that come to us sometimes are a victim of environmental factors such as no health care insurance. And we are really encouraging the Lansing School District parents that have no health insurance to call 211 and to become part of this program, because it will help their children in the future. And if they need an interpreter, they can call Sergio Keck's office and he'll interpret or have somebody interpret for them. Thank you very much.
Thank you, Marty, and thank you to Dr. Guertin and to Kim as well. As you've heard, it's a very powerful message that if our children are not healthy, it's going to be very difficult for them to succeed in school, and we can all understand what that means for their long-term success as well. Just a personal note, I have a 7-year-old son and a 5-year-old daughter. They have been blessed to have outstanding health care insurance coverage from day one. I believe that every family in the state of Michigan, every child in the state of Michigan, should have that same opportunity. And with this program, there is frankly no reason why they shouldn't. We simply need to shine the light on the existence of these programs and get people enrolled. It's the right thing to do for all of the reasons you've heard about this morning. At this time, I'd like to debut for you one of the public service announcements that you will be seeing, and hopefully our target audience will be seeing in the weeks to come here in the state of Michigan. If we could please roll the video at this time. Thank you.
Do your children have health insurance? If not, there's a good chance they could get it. MiChild and Healthy Kids are Michigan's free and low-cost health insurance programs for kids. They cover doctor's visits, checkups, immunizations, prescriptions, dental, vision, hospital care, and more. Enrolling is fast and easy with little paperwork involved. Enroll your children in MiChild or Healthy Kids. Call 211 or go to enrollmichigan.com. Do your children?
So there you have it. Very simple and concise message. Call 211. Log on to www.enrollmichigan.com. All of our speakers this morning will be available for members of the media if there are follow-up questions that you'd like to ask. And at this time, I'd like to thank all of you for being here today and for supporting this critically important effort. Thank you so much.